When a person's wondering how to get help for substance use, they often consider therapy. There are many different types of therapy, including individual and group counseling and peer support groups. But many types of medication can help as well. We call these medication-assisted treatment, or MAT. MAT is prescribed by a medical professional. It's effective and safe when used as prescribed. Some people may prefer trying to go through recovery without MAT, but it is perfectly fine to take MAT. After all, addiction is a chronic medical condition, so it is appropriate to take medications to treat it. In fact, many rigorous studies have found that the combination of MAT and counseling is the most effective treatment for opioid use disorder available today. There are many MAT options. MAT helps decrease cravings, or makes opioid use feel unappealing. Some forms of MAT even prevent withdrawal symptoms. A clinician helps choose which form fits a person's needs. These medications can be taken as long as they're helpful to recovery, but should always be used with mental health counseling. The combination of MAT and mental health counseling addresses opioid use disorder's physical and psychological effects. There are 3 forms of MAT that are particularly helpful for opioid use disorder: buprenorphine, methadone, and extended-release naltrexone. Buprenorphine has several brand names, including Suboxone, Subutex, Zubsolv, Probufene, and Sublocade. Here's how it works. Opioids activate receptors in the brain called mu receptors. When the receptor is activated, persons feel the pleasant effects of opioids. Buprenorphine itself is an opioid, but it is far less potent than other opioids. So, buprenorphine treats opioid use disorder by partially activating the mu receptor. As a result, the person doesn't crave opioids of abuse, like heroin or prescription pain pills. This lets them focus on other things, like their recovery, school, work, and relationships. It also prevents withdrawal symptoms. Because buprenorphine only partially activates the mu receptor, there's a natural limit as to how much it can affect the brain. This is called a ceiling effect. Once the limit is reached, buprenorphine can't have any additional effect, which keeps someone from wanting to take too much. At the right dosage, buprenorphine prevents pleasurable feelings from other opioids, because the mu receptor is already occupied. Buprenorphine is usually taken orally as a pill or film placed under the tongue, once or a few times a day. People who take buprenorphine usually visit their health provider once a month. Typically, this involves a urine drug screen to make sure the drug is taken as prescribed, and a chance to discuss progress and concerns. A health provider usually prescribes a month's supply of oral buprenorphine, which can be picked up at a local pharmacy and taken at home. Buprenorphine can also be taken as a weekly injection or an implant that lasts 6 months, but a person needs to have used oral buprenorphine successfully before trying the injection or implant. Like all forms of MAT, buprenorphine should be used along with regular mental health counseling. Before beginning buprenorphine, a person has to be in partial opioid withdrawal, meaning they have not taken opioids at least 24 hours prior to treatment. It's really important to use buprenorphine as prescribed, since overdose can occur when it is misused. Methadone is another form of MAT. It's a liquid taken by mouth. It's been around for decades, and millions of people have taken it to control cravings, prevent withdrawals, and decrease or eliminate the desire to use other opioids. Like buprenorphine, methadone targets the brain's mu receptor. Methadone is much stronger than buprenorphine and has more risks because it doesn't have a ceiling effect. That's why many prefer trying buprenorphine first. By law, methadone must be obtained at an opioid treatment program, often called a methadone clinic. Patients on methadone must visit the clinic daily until they are stabilized, at which point the clinic may allow the patient to take a few days' worth of methadone home at a time. Methadone can have serious risks if it's misused, including overdose, so it's really important that it's taken as prescribed. Unlike buprenorphine treatment, methadone treatment can begin at any time, whether or not the person is in withdrawal. And like all forms of MAT, it should be used in conjunction with counseling. Extended-release naltrexone is another MAT treatment for opioid use disorder. Its brand name is Vivitrol, and it's an injection that's given once per month by a health provider. Rather than activating or partially activating the mu receptor, extended-release naltrexone completely blocks the mu receptor. Like methadone and buprenorphine at the right dosage, extended-release naltrexone helps prevent the ability to get high. But unlike those medicines, it doesn't have an opioid ingredient, and it isn't a controlled substance. Before beginning extended-release naltrexone, it's necessary to completely detox from opioids. This means not using any opioids for 1 to 2 weeks. Detox might sound scary, but there are ways to make the process seem comfortable. Some people choose to enroll in a medically supervised detox program. Others prefer to detox at home, but this can be hard unless you have a strong support network. Anyone considering extended-release naltrexone should talk with their health provider to find out which options are best for them. Extended-release naltrexone is also used to treat alcohol use disorder, so it can be a good option for persons who have both opioid and alcohol use disorder. Because extended-release naltrexone completely blocks the mu receptor, people who take it can't have any opioids, even during surgery. And like all forms of MAT, extended-release naltrexone should be used with mental health counseling. Like all medications, MAT can have side effects. There are a lot of myths out there about MAT. One myth is that it makes you feel high, but if taken appropriately and under the care of a health provider, it just makes a person feel back to normal. Another myth is that MAT just replaces one addiction with another. But instead, MAT actually treats addiction in ways like controlling cravings and helps an individual recover. Finally, some people mistakenly think that MAT is a crutch that prevents the hard work of recovery. But recovery is hard work whether or not someone takes MAT. To review, there are 3 forms of MAT that are particularly helpful for opioid use disorder: buprenorphine, or Suboxone, methadone, and extended-release naltrexone. A person who wants to begin MAT should discuss it with their clinician. To find an MAT provider, you can check out the provider locator on the Substance Abuse and Mental Health Services Administration webpage. This government agency also has the most up-to-date information on evidence-based treatments for opioid use disorder.